So what if the secret to younger looking skin has been hiding in plain sight, but no one's talking about it? In this video, I'm revealing the surprising truth behind estrogen creams, the anti-aging benefits that you could see that would change everything for your skincare routine, and the risks you need to know before trying it. Trust me, you won't want to miss this video. I had a patient come in yesterday and she said, "Doc, it's gone. Those wrinkles are gone." She pointed to the smile lines right here at the side of the face. I said, "Great, you just saved yourself $5,000. But what did you do?" You see, it took her 2 months to get in and see me, and in the meantime, she started something, a cream. I go, "Well, what?" And she was a little vague. She goes, "Well, a cream for down there, and I used it up here." But it's not going to be that simple for all of you, so let's dive in. And by the way, I'm wearing glasses today. I had lenses placed in my eyes and we're still adjusting them. I can't be exposed to certain frequencies or wavelengths, of light, so bear with me. Now let's start with a quiz you cannot possibly get wrong. Here it is. What percent of women get estrogen loss? So what percent of you who are women will get estrogen loss in your lifetime? 100%. Exactly. It's not if, it's when. That's the importance of this video. This is a nice chart showing estrogen levels. You can see by age 35, it's kind of peaked. A little erroneous here. By 40 to 50, there's much less than what they're showing. The estrogen is shown in the dark purple, but you can see clearly 60, 70, 80, the levels are very low in that light purple kind of color. I'm sure you'll also ask, well, if we're low on thyroid, we just add more thyroid. Why don't we add more estrogen? I'll discuss. And before we really get into it, yes, I'm talking hormones today, specifically, topically, of course, but the loss of estrogen on the skin, in the body, and fluctuations of hormones, I see in my clinic starting younger and younger. And if it's starting around 35, that's not too uncommon. And don't be gaslit, by the way, by your doctor if you're presenting with kind of systemic symptoms of odd things you might not associate with, like paresthesias, where you just feel differently, sensations throughout your body, frozen shoulder, bloating, thinning of the hair, distraction, brain fog. So definitely see an expert, but I want to get that out of the way first because many of you are suffering from this. I see it in my clinic. And in fact, 8 of the last 10 patients I had this week in my clinic present newly. They were all perimenopausally. So this is all related. It's a time of change for women. Check this out. In one study, after 6 months of topical estrogen use, skin elasticity and firmness had improved, and wrinkle depth, are you ready, and pore size had decreased by 61 to 100%. Colossal. So on to the cream for down there, used up here. Now, before you rush out and smear your face with hormones, let's get into the science a little bit, the pros and the cons, and whether it's a good idea to swap your current moisturizer for an estrogen boosting one. Okay, here is the exact cream that she brought in. Estradiol Vaginal Cream, 0.01%. Now, it is estradiol, and there are other ingredients in here, but nothing that would make such a big change that all the wrinkles were gone. But this is exactly what you're looking for. And it was, I think she said about $40 US, USD. Spoiler alert here, it's more complicated than you think. We're talking hormones, so it's complex by nature, but the most commonly used and cheapest estradiol cream that some women might use, what we call off-label for facial application, is Estraze, which is estradiol 0.01%. Estraze is a prescription cream primarily intended for vaginal atrophy and menopause and those related symptoms, but it's repurposed for skin application due to estrogen's potential anti-aging benefits. We'll talk about compounded versions in a minute because some of you are using those already. But if you're on hormone replacement therapy, do you still need the creams? That's a most asked question. And the answer is yes. In my practice, even those who are on hormone replacement, patches, some people are on pellets, some people put creams on the arms that are absorbed into the skin or at different parts of the body, they still benefit from the cream that's placed directly on the skin where you want to affect change for wrinkles and to help thicken your dermis. However, estraze is typically not marketed, you won't see it marketed, officially recommended for facial use. And its price can vary, of course, and some people have it covered by insurance. I know some of you, comment below. And then there are generic versions of estradiol creams, which are also available that you can get typically cheaper. And then, of course, there's compounded ones. Now, this gets complex. Many of you are on these because these are the least expensive. That means that a pharmacy that does compounding makes it up. It's usually not exactly the same dosing as the ones that are commercially available. And often they'll add a few other elements or ingredients, and it's much cheaper. Here's the hook. And I get compounded things all the time. You need to know, those of us who use medications like this, you need to know which pharmacy is doing it. Now, when you're talking hormone replacement, we know because what we'll do is put people on hormones and then you measure levels. And when you're seeing tens and hundreds of people, you then know, oh, this dosing from this pharmacy works like this. And you'll go online, if you search compounding pharmacies, you'll see a lot of nefarious issues that have gone on in the past and non-sterility issues. So know where you get it if you're getting compounded versions. I do want to make that point. These are not regulated pharmacies. And you know the state in America, the state with our workers, people are making mistakes rampantly. So know where you're getting your product. Now, melasma, another oft-asked question. These are the dark spots called the mask of pregnancy. And the reason is a lot of people have melasma from the sun, from heating, and some people get them from hormones. So can you get that with this? Yes, you have to be mindful if you're melasma prone. In a moment, I'll give you a tip and a trick for those of you suffering from dark spots from hormones. See if you can use it or not. Before you reach for your estrogen cream, the elephant in the room remains. We all know that aging isn't just about birthdays. It's about sun exposure, genetics, diet, and all of those fun lifestyle factors that play a role. Air pollution and pollution damage to your skin. So the number one ager of your skin is photo damage. So before you go directly for the estrogen cream, you want to take care of your basics first. You want to think of estrogen as the skincare fairy who keeps your skin firm, plump, and hydrated. As menopause hits, that fairy goes on vacation and suddenly your skin isn't bouncing back the way it used to. I shouldn't say on vacation, I should say on retirement, because it rarely goes the other way around. You see, you lose collagen up to about 30% in the first 5 years of menopause. Think of elastin that weakens, skin hydration plummets. The result is wrinkles and dryness. Yep, I did say dryness. Many of you relate to that. And that, of course, leads to sagging. So why did my patient get such an amazing result? Why is estrogen cream the holy grail for so many people? Well, it's like the skin's personal trainer. It keeps everything in shape. It helps produce collagen. It helps produce elastin. And it helps those magical molecules that hold onto water in your skin that some of you try and take topically, like hyaluronic acid. Without it, the skin becomes less firm and dry. These benefits are proven by science. This is why during menopause, skin can become fragile and slower to heal. Remember, we always look at the skin's ability to heal and correlate that with its healthiness. And if things make it heal quicker, we know that's great skincare. One thing you get is increased blood flow. We know how much that helps. That's why we like gua sha. But remember, when you get increased blood flow, some people will see increased broken capillaries, increased slight redness of the skin. So be mindful for that. So then, can you just slather on the estrogen cream and reverse aging? It's not quite that simple, however, and here's why. Think of your estrogen cream kind of like fertilizing your garden. Okay, you add nutrients to make sure the plant grows better, and this would be your wrinkles going away, but you overdo it in your garden and you're going to get weeds. But worse yet, you can accidentally fertilize your neighbor's yard. In the same way, using estrogen cream can have effects beyond your skin, and that's what we're worried about. You see, you also have breasts, possibly a uterus, and you can even extend that to ovaries. There's evidence that unopposed estrogen can affect the ovaries, and ovarian cancer is something you definitely don't want. So there are risks and side effects. So this is where things get tricky. While topical estrogen is a game changer for some, understand there is some evidence that it gets absorbed into the body and potentially can cause side effects. Where do we get our data from face absorption from? Because there isn't much, if any. Well, it's from vaginal application, and the fact that, and there is division here. A lot of people think that, okay, you get systemic absorption from vaginal application, and I believe that's true because enough of my patients will say if they're on vaginal hormone replacement, so vaginal estradiol, they get tenderness in the breast for a while. But we look at the studies from that application, and really the risk of uterine cancer and breast cancer is not appreciably increased, although some people would disagree with that. But by and large, the use of vaginal estrogen cream is deemed safe. Thus, we extrapolate that on the face, it's deemed safe. The levels aren't high enough to cause those problems. But I have to tell you, in clinical practice, vaginally, which there's much more absorption than on the facial skin, because it's a mucous membrane, people do get some systemic symptoms, just doesn't bear out that they get the side effects of increased cancer risk that's appreciable. Now, here's from breastcancer.org, vaginal estrogen safe for women with breast cancer. These are certainly worth reading on your own if you want more information. Are you getting screened? Are you getting mammography, low-dose radiation mammography? Better yet, for many people, MRI. And yes, I know we have the Nurses Health Initiative trial. I did a whole video on that. I'll link that at the end. It's important for you to know. And I'm a believer in hormone replacement therapy for women, but you have to be the right candidate. And I think it's worthwhile, of course, going over with your provider your risk factors if you're going on a cream like this. And yes, the Nurses Health Initiative study, it was a flawed study. Think progestins. That's for another video. I did make that video, and again, I'll link it. So let's go through the exact risks. I just mentioned breast tissue stimulation. If you have a history or personal history of breast cancer, or you're at high risk, then it can be a concern. Definitely talk to your doctor. Well, now you're going to ask, what about blood clots and cardiovascular risks? From the data, everything looks safe. I feel comfortable here for most people. But systemic absorption could still lead to issues like blood clotting, especially with long-term use. Again, see your provider, but for most people, depending on the risk factors, it's very reasonable risk, if any risk here to take. Skin irritation, like any cream, I sometimes see some redness. We talked about broken capillaries already. I talked about melasma, which you're going to come back to. Fragility of vessels in the face, for sure. One thing, if you have melasma, and particularly maybe you're on the birth control pill and then you got that mask of pregnancy or the mustache, you want to consider using it in an inconspicuous area, like maybe the skin at the lateral face here, maybe where if you're wearing your bangs or hair down, maybe on top of your forehead. Small amounts, go slowly, and then start slowly if you're going to start the cream, and then avoid being exposed to heat or sun. That can be confounding variables for this. Remember, just like everything I talk about, what works wonders for your neighbor means it could be a disaster for you, and that's why you're seeing a provider with things like these. Luckily, too, we do have alternatives. So if using estrogen on your skin sounds a little too risky for you or you have risk factors, don't worry. There are alternatives. Let's talk about phytoestrogens and MEAP for a minute. Phytoestrogens are plant-based compounds. You would have heard of these. They mimic estrogen, but without the full hormonal punch. What do the studies say? Well, they suggest that these can improve your collagen production, improve wrinkles, and increase skin hydration. And it's not by taking estradiol. It's these phytoestrogens. They also, too, they are antioxidants. Genistein is a naturally occurring compound abundantly found in these soybeans, fava beans, and other lentils. Yes, the chemical structure is similar to estradiol, but it's a plant-based compound that mimics your estrogen. So you can look for products that have that in it. The other one is MEAP, methyl estradiol propanoate. Say that a few times, that's a tough one. But it's another option. It binds estrogen receptors on the skin, but it does not get absorbed into the bloodstream, meaning fewer systemic risks. Systemic means throughout your body. So think of it as an estrogen light. So these products, there are some on the market that have these. Often they're really expensive. Like I know one, it's about $400 to get started on this. So these are patented ingredients. So if you're going to go down that road, you're going to have to shell out. The safest and most proven thing you can do for your skin, of course, is avoiding the sun damage, the photo damage. So using sunscreen, retinoids, glycolics, and using peel pads. If you're on those products, you're doing 80 to 90% of the work. A great thing to add to that routine is red light and red light therapy. And there's a complete video up here on that. And one down here on peel pads that you can use at home, glycolic ones, to help with your sunspots, keep your skin smooth, to keep your skin and body beautiful, healthy, and vibrant.